The KEYNOTE-24 trial has been a randomized trial investigating the anti-PD-1 antibody Pembrolizumab compared to platinum-based chemotherapy in untreated patients with advanced non-small cell lung cancer and high PDL-1 expression. This has been one of the very important first-line trials investigating the efficacy of immune therapy. So the patients have been screened for the trial. We were looking for the EGF receptor mutations and the ALK translocations. They only were eligible when they didn't have this activating oncogenic alterations. And furthermore, we were looking for the PDL-1 expression status. So they needed to have a confirmed high expression of PDL-1, and this has been validated by a central review. And then, if they were in an adequate performance status, they were eligible for randomization, so they were eligible for the treatment randomization to the immunotherapy with pembrolizumab as a monotherapy or platinum-based chemotherapy. Well, the primary endpoint has been progression-free survival, assessed by independent radiological review, and we have seen a clear, significant improvement of progression-free survival favoring pembrolizumab, and this has been corresponding to a hazard ratio of 0.5, and this has been corresponding to a prolongation of the median progression-free survival from 6 months up to 10.2 months in favor of pembrolizumab. Furthermore, we also analyzed overall survival, and we also find a significant improvement in overall survival corresponding to a hazard ratio of 0.6, despite the fact that 50% of the chemotherapy patients did crossover to immunotherapy at the time point of progression. And this is really an amazing outcome for a first-line trial. Overall, the tolerability profile was in favor of pembrolizumab, so the incidence of severe grade 3 and 4 adverse events was substantially lower in the group of patients who received pembrolizumab to chemotherapy. In roughly 30%, we did observe immune-mediated adverse events, but for most of these patients, they appear in a low or moderate degree of severity as a grade 1 or 2 immune-mediated adverse events. Immunotherapy has already completely changed management of lung cancer patients. And we have seen immunotherapy in the place of second-line therapy. What is new now is that we have a completely new option for first-line patients with a high PDL-1 expression. So my vision is that immunotherapy will completely restructure our management of patients with metastatic non-small cell lung cancer.